Hello, good evening to one and all. फटाफट लाइव जोड़ ही जाओ। फटाफट वीडियो को लाइक कर दियो, है ना। गुड इवनिंग जोशना, गुड इवनिंग संयुक्ता, संतोष, सारला पंडा and कल्पना शाह, गुड इवनिंग। जोड़ा को क्वेश्चन 400 क्वेश्चन आम देखी सारी, राइट। अभी 401 नंबर क्वेश्चन आम देखा आज क्लास 2 क्लास 401 नंबर क्वेश्चन आम देखा, देन एटलिस्ट 100 क्वेश्चन सॉल्व करवा बेटा, राइट। So question number 401 is which of the following route is contraindicated for administration of potassium chloride? Which of the following route is contraindicated for administration of potassium chloride? Option A, KCl in bolus from via IV route, KCl in IV fluid, KCl via IM route, and option D is infusion via central line. So which option is the correct answer, beta? Good evening, Kaveri Malik. Good evening. God bless you. So, beta option A होगा, right? is contraindicated for administration of potassium chloride. हमें बोलस IV बोलस दवा की दवा नहीं ना, rapidly दवा नहीं ना, बोलसली means बेटा at a time rapidly दे दो बेटा, right? Option A is the correct answer बेटा। IV fluid तो दिया हो चला, बोलसली दे दिले नहीं कि बेटा सांगे संग डायरेक्ट सर्कुलेटरी सिस्टम रे पार्टिसिपेट कर दबा ना, कार्डियक अरिथमिया हो, कार्डियक अरेस्ट इज पेशेंट, राइट। ऑप्शन ए इज द करेक्ट ऑप्शन हो बेटा। हाइपरकैलेमिया हबार चांस अच्छी, देन कार्डियक अरिथमिया हबार चांस अच्छी, हमें डायरेक्ट बोलसली यदि पेशेंट को आईवी पुश कर दबा, रैपिड एडमिनिस्ट्रेशन है ना, रैपिडली दे दिए असुविधा हवा बेटा। तो ऑप्शन ए इज द करेक्ट आंसर। केसीएल हमें सब स्लोली दौचे है ना, नहीं एंड डायल्यूटेड विथ आईवी फ्लूइड सहित डायल्यूट करके हमें दौचे, बुझीपार। Good evening, Lalita Mahanand. Good evening. Next question, question number 402. Doses of adrenaline are being used in neonatal resuscitations. Doses of adrenaline are being used in neonatal resuscitations. Option A is 0.1 milligram per kg, that is 1 ml per 1:10,000. Then option B is 0.01 milligram, that is 0.01 milligram to 0.03 milligram per kg. It is 0.1 ml per 1:10,000. Option C is 0.05 milligram per kg. It is 0.1 ml. 0.1 ml. It is 0.1 or 1:, sorry, 1 point not, this is not 1:1,000. Option is 1.0 milligram per kg or 1 ml, that is 1:1,000. So which option is the correct answer, beta? The recommended adrenaline doses for neonatal resuscitations. Which option is the correct answer? Very good. Option B is the correct answer, beta. Option B is the correct answer. This is the recommended dose 0.01 milligram to 0.03 milligram per kg, and it is 0.1 ml. केमती आम कौन कर 1:10,000 रेशियो रे डाइल्यूशन करके दौर, राइट? ऑप्शन बी इज द करेक्ट आंसर, बेटा. नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 403 अछि. व्हिच वन ऑफ द फॉलोइंग मोस्ट इंपोर्टेंट एमसीक्यू, बेटा मन रखिता हैला. मोस्ट इंपोर्टेंट एमसीक्यू. Next question, question number 403. Which one of the following fast line drug used to manage post resuscitation hypotension? Which one of the following fast line drug used to manage post resuscitation hypotension? Option A is ADR, that is adrenaline. Option B is noradrenaline. Option C is dopamine. Option D is IV fluid. So which option is the correct answer, beta? फटाफट आंसर कर दो. Fast line drug used to manage post resuscitation hypertensions. First line drug is used to post resuscitation hypotensions. So correct answer is beta option B, right? Option B is the correct answer, noradrenaline. Option B is the correct answer. Noradrenaline or कौन कहते बेटा याकू नॉरएपिनेफ्रिन. है ना? गुड इवनिंग सोनालिका, गुड इवनिंग बेटा. Next question, question number 404 अच्छी. Selective digestive decontamination is used to prevent. Selective digestive decontamination is used to prevent. Option D is vomiting, diarrhea, abdominal distension. Option D is infections. So which option is the correct answer? फटाफट आंसर कर दो. So correct answer is बेटा infections, right? कौन है infections. So selective digestive decontaminations is used to prevent infections. Right, next question, question number 405. Drug used to prevent aspiration and decrease the secretion each. Most important MCQ. Drug used to prevent aspiration and decrease the secretion each. Option A is adrenaline. Option B is noradrenaline. Option C is dopamine. Option D is atropine. So which option is the correct answer, beta? So correct answer is atropine, beta. Atropine drug is used to prevent aspiration and decrease the secretion. Right now, your drug used to prevent aspiration and decrease the secretion is atropine. Very good, Suchitra. Atropine is the correct answer. Next question, question number 406. Drug of choice for hypertensive crisis. Option A is phenylamine. Option B is phenytoin. Option C is diazepam. Option D is sodium nitroprusside. So which option is the correct answer? Drug of choice for hypertensive crisis. Hypertensive crisis. Severely जेतुले blood pressure elevation होची ना, elevated होची, increased होची बेटा, that is hypertensive crisis. Severely increased or elevated blood pressure. आई समय कौन चांस है organ damage हमारा चांस पूरा मोस्ट बोलता है बेटा. तो इस समय आम को ड्रग्स दवाक पड़ो phenylamine, phenytoin, diazepam, sodium nitroprusside. So which option is the correct answer? Good evening, Priyanka Jana. So correct answer is option D is the correct answer. Option D is the correct answer. Option D is the correct answer. Sodium nitroprusside is the drug of choice for hypertensive crisis, right? Most important MCQ mane rakhita beta. Next MCQ है 407 है fungal laryngitis. Fungal laryngitis can be treated by using option रचे Donatal, option B रचे fluconazole, and option C रचे promethazine, option D रचे carbamazepine. So which option is the correct answer beta? Donatal, fluconazole, promethazine, carbamazepine. Which option is the correct answer? फटाफट आंसर कर दो. Fungal laryngitis means beta inflammation of the larynx, right, caused by the fungus. Fungal laryngitis means inflammation of the larynx caused by fungus, that is fungal laryngitis, can be treated by using which medications? Antifungal medications. हाँ ना नहीं, antifungal medication code है बेटा, antifungal medication दबाग पड़ेगा है ना नहीं, antifungal. Which option is the antifungal medication or medicines beta? Fluconazole, very good. Fluconazole comes under antifungal medications. है ना नहीं? Option B is the correct answer. Very good. Next question, question number 480. What is the role of activated charcoal in the treatment of poisoning? What is the role of activated charcoal in the treatment of poisoning? Most important MCQ. Option is act as an effective antidote. Option B is act as an anti-epileptic. Option C is stops further absorption of poison into the blood. Option D is act as a sedative. So which option is the correct answer beta? So correct answer is option C, right? Option C is the correct answer. तो एक्टिवेटेड चारकोल कौन करे बेटा? एब्जॉर्ब्स इंजेस्टेड टॉक्सिन्स, जहाँ खाई देवा नहीं कि जो टॉक्सिन्स खाई देवा कि जो पॉइजन खाई देवा तो कौन करे वैसे? Activated charcoal absorb ingested toxins within the gastrointestinal tract, preventing the systematic absorption of that toxins, right? Systemic absorptions reabsorb होवा पाए बेटा कौन करेगा से प्रिवेंट करेगा in GI tract, right? So option C is the correct answer, right? Option C is the correct answer. But next question, question number 409 dose related adverse drug reaction is called option BJR, option augmented, option C end of use, option D failure. Dose related adverse drug reaction is called dose related adverse drug reaction is called BJR. Option B augmented, option C end of use, and option D is a failure. So which option is the correct answer? कौन कौन दे बेटा? augmented कौन दे, right? This is augmented. Option B is the correct answer. Dose related adverse drug reaction is called augmented, right? Option B is the correct answer. Next question, question number 410 beta. Vasopressor or medication that are used to option is decrease cardiac output, is C, and systemic vascular resistance, that is SVR. Option which is increased cardiac output CO and systemic vascular resistance SVR, and option C is decrease mean arterial pressure MAP, and option D is decrease perfusion to organs. So which option is the correct answer beta? Correct answer is option B, right? Option B is the correct answer. Increased cardiac output and the systemic vascular resistance SVR, right? So vasopressor medication mainly used or primarily used to increase systemic vascular resistance, right? And cardiac output. So option B is the correct answer, beta, right? Next question, question number 411 है बेटा. Sotalol is a beta. Sotalol is a beta blockers that blocks the option is calcium channel of the heart. Option B is a potassium channel of the heart. Option C is a magnesium channel of the heart. Option D is zinc channel of the heart. So which option is the correct answer, beta? So correct answer is option B, potassium channel of the heart, right? Sotalol is a beta blocker that blocks the potassium channel of the heart, right? So option B is the correct answer. Next question, question number 412. Germicide applied in a living surface is called. Germicide applied on a living surface is called. Option A antibiotics. Option B is antiseptics. Option C is antitussives, antitussives, and option D is disinfectants. So which option is the correct answer, beta? Antiseptics is the correct answer, na? Option B is the correct answer. हाँ ना नहीं? Germicide applied on a living surface is called antiseptics. Option B is the correct answer. And this is applied in living tissue and skin. No, no. Option B is the correct answer. Next question, question number 413. Which pharmacological measure is effective for treating neuropathic pain? Which pharmacologic measure is effective for treating neuropathic pain? Option A non-steroidal anti-inflammatory drug, right? Then option B is serotonin norepinephrine reuptake inhibitors. Option C is antihelmintic. Option D is antibiotics. So which option is the correct answer? Effective for treating neuropathic pain. Option B is the correct answer. Serotonin norepinephrine reuptake inhibitors is the correct answer, right? Sorry, serotonin reuptake inhibitors. कौन example बेटा? Deloxatin. This is comes under SNRI, SNRIS. This is comes under SNRIS, right? Serotonin norepinephrine reuptake inhibitors. Deloxatin, venlafaxine. How can I say venlafaxine? These all are comes under SNRIS, right? So correct option B, beta. Next question, question number 414. What is the mechanism of action of heparin? What is the mechanism of action of heparin? Option A is prolongs bleeding time. Option B is prolongs clotting time. Option A is prolongs bleeding time. Option B is prolongs clotting time. Option C is acts as an effective coagulant. Option D is acts as an effective antidepressant. So which option is the correct answer? फटाफट आंसर कर दिया बेटा, फटाफट आंसर कर दिया. So which option is the correct answer? Yosho Shunani, option B. Very good. Option B is the correct answer, beta. Option B, Suryanarayanapati. Option B only correct answer, right? What is the mechanism of action of heparin? Prolongs clotting time. Right, option B is the correct answer, beta. Option B is the correct answer. Next question, question number 415. What type of nomenclature of drugs is case and easy to remember? What type of nomenclature of drugs is case and easy to remember? Option A is chemical name, option B is generic name, option C is proprietary name, option D is non-proprietary name. So which option is the correct answer? But important MCQ, right? What type of nomenclature of drugs is case and easy to remember? But option C is the correct answer, right? Option C is the correct answer. Proprietary name means better brand name, right? Proprietary name is also known as brand name or trademark name or अब कौन कौन थे बेटा trademark name. It is catch and easy to remember, right? Next question, question number 416. The relationship between drug concentration and time is known as option A pharmacokinetics, option B pharmacodynamics, option C pharmacogenomics, option D pharmacovigilance. So which option is the correct answer? फटाफट आंसर कर दो. The relationship between drug concentration and time is known as pharmacokinetics. So option A is the correct answer, right? Option A is the correct answer. Next question. Question number 417. Which among the following drug is obtained from leaves? Which among the following drug is obtained from leaves? Option A digitoxins. Option B tevocurine. And option C emetine. Option D vancomycin. So which option is the correct answer? So correct answer is option A. Digitoxins, right? Digitoxin is the correct answer. Option A. Very good. Option A is the correct answer. But our next question, question number 418. Medical treatment of coronary artery disease includes which of the following procedures? Medical treatment of coronary artery disease includes which of the following procedure? Option A cardiac catheterization. Option B oral medication administration. Option C coronary artery bypass grafting. Option D percutaneous translaminal coronary angioplasty. So which option is the correct answer? Medical treatment of coronary artery disease includes which of the following procedure? So which option is the correct answer, beta? Very good, Surya Narayanapati. Option B is the correct answer, beta. Right? Option B is the correct answer. Medical treatment, na? Very good. Good idea. Option B is the correct answer. Oral medications is the correct answer. Option B is the correct answer. Medical treatment of coronary artery disease (CAD) includes which of the following procedures? Oral medication. This is the medical treatment. All are the surgical treatment. हाँ ना नहीं? Option B is correct answer. But option B is the correct answer. Next question, question number 419. Sports person enhance mental and physical capabilities by taking. Sports person enhance mental and physical capabilities by taking. Option A is anabolic steroids. Option B is caffeine. Option C is whiskey. Option D is high caloric food. So which option is the correct answer? कैफेन नहीं बेटा कैफेन तो हम ना so correct answer is बेटा anabolic steroids right anabolic steroids this is the drugs that enhance the mental and physical capabilities of the sports persons. This is the hormonal replacement beta. This is work like hormones right this is work like hormones like testosterone बोले काम करेगा right option A is the correct answer. Next question number 420. Unwanted but unavoidable pharmacodynamics effect of a drug at the therapeutic dose are known as unwanted but unavoidable pharmacodynamics effect of a drug at the therapeutic dose are known as option A रची hypersensitivity option B रची side effect option C रची toxic effects option D रची idiosyncrasy. So which option is the correct answer? फटाफट आंसर कर दिया. Very good, Sonalika. Nipun Mahakud option B. Surendra option B. Small beds option B. Sarlapanda option B. Very good. Option B is the correct answer. So side effects are the unwanted but unavoidable pharmacodynamics effects of the drugs at the therapeutic doses. And option B is the correct answer. Very good. Next question number 421. Which of the following anti-tubercular drug causes a red-orange discoloration of urine? गतकाले पढ़ाई ची ये questions. Answer करो फटाफट. Anti-tubercular drugs causes red-orange discolorations of urine. बेटा आसिबो question. ये सब questions आसिबो. एमपी question ही आसिबो. Which of the following anti-tubercular drug causes red-orange discoloration of urine? Isoniazid, streptomycin, ethambutol, rifampicin. So which option is the correct answer? फटाफट आंसर कर दिया. सोनालिका rifampicin. पूजा नंदा option D. सरलपंड option D. Small bites option D. Sachitra option D. Padma Naik option D. Very good. Lalita Mahananda option D. Surya Narayan Pati option D. Very good. Rifampicin is an anti-tubercular drugs and this is the known cause characteristics of red orange discoloration of urine. हाँ ना नहीं? And rifampicin quickly eliminated in the vial. So option D is the correct answer. बेटा very good बहुत बड़ा ठीक मान रखी तब मैंने right. Next question number 422 is recommended concentration of adrenaline during neonatal resuscitation. Recommended concentration of adrenaline during neonatal resuscitation. पुणे तरह repeat वाला questions. So which option is the correct answer बेटा? Correct answer is option A. 1 is to 10,000. 1 is to 10,000, right? Option A is the correct answer, right? Next question number 423. Most common drug is used in diarrhea. Most common drug is used in diarrhea. Which option is the correct answer, beta? Option A is loperamide, option B is disulfiram, option C is acetaminophen, option D is atropine. So which option is the correct answer? फटाफट आंसर कर दिला. Very good. Option A is the correct answer. Loperamide बेटा एबे भी मोस्ट ऑफ ऑल कंट्री रे यूज करा जाउची इंडिया रे मध्य हला देखिबा को पाइबा ए मेडिसिन्स to manage diarrhea symptoms and this medication slowing down the bowel movements. Right now option A is the correct answer. Beta loperamide is the correct answer. Right, slowing down करेगा ना bowel movements को ये एंटी मोटिलिटी ड्रग हो जाए बेटा. इट इज एन एंटी मोटिलिटी, इट इज एन एंटी मोटिलिटी ड्रग्स. Right, Surya Naranpati. Next question, question number 424 is a drug of choice for organophosphorus OP is poisoning. Organophosphate poisoning. So which option is the correct answer? Atropine, uh, pralidoxine, adrenaline, naloxone. So which option is the correct answer? बेटा फटाफट आंसर कर दे, फटाफट आंसर कर दो. So correct answer is कौन है? Atropine. Very good. Option A is the correct answer. So drug of choice for organophosphate poisoning, that is atropine. बेटा भूल करिबो नहीं, क्वेश्चंस आसीबो निहाती भाबरे ए क्वेश्चंस को भूल करिबो नहीं आसीले. राइट, नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 425. Identify the correct way to mix NPH insulin with regular insulin. Identify the correct way to mix NPH insulin with regular insulin. Option A mix regular and NPH insulin. Option B take NPH first. Option C take regular insulin first. Option D all of the above. So which option is the correct answer beta? So correct answer is option C beta. Option C is the correct answer. क्या हो गया इसको, सिस्टम को क्या हो गया? आंसर कर दो फटाफट. सो ऑप्शन सी इज द करेक्ट आंसर. टेक रेगुलर इंसुलिन. राइट, टेक रेगुलर इंसुलिन. Option C is the correct answer. When mixing NPH and regular insulin, so regular insulin कौन बेटा? Clear दिस तो NPH insulin केंद्र दिसे cloudy दिसे है ना नहीं? So take regular insulin first. Right? Option C is the correct answer. Next question, question number 426. Which of the following is the most common adverse effect of LT flage? Option A is headache. Option B is weight loss. Option C is epistaxis. Option D is hypoglycemia. So which option is the correct answer beta? Which of the following is the most common adverse effect of LT flage? But LT flage it is a thrombolytic agent beta. This is a thrombolytic agent, right? This is a thrombolytic agent. This is a thrombolytic agent. So which of the following is the most common adverse effect of LT flage? The correct answer is option C, epistaxis. Very good. Epistaxis is the correct answer. This is nosebleed. I don't know. Epistaxis or nosebleed, and it can occur due to LT flage treatment. So dissolve blood clots जदि आम LT flage को जदि आम यूज कर ले हाँ ना, and this is the significant cause and side effect of LT flage. epistaxis हबो हाँ ना. आम जदि ब्लड क्लॉट्स को डिजॉल्व करबा पय मेडिकेशन देले LT flage thrombolytic agent यूज कर ले ताले epistaxis हबार चांस अछि. दिस इज द साइड इफेक्ट ऑफ LT flage. राइट, बुझी पला ना नहीं? Next question, question number 427 is a patient is taking carbamazepine. Which of the following lab findings suggestive to side effect of carbamazepine? Option is sodium level 140 milliequivalent per liter. Option B is BUN 10 milligram per deciliter. Option C is WBC count 3000 cubic millimeter cube. Option D is keratinite level 3.5 milligram per deciliter. So which option is the correct answer, beta? The correct answer is option C. The correct answer, WBC count 3000 cubic millimeter cube. Right. So WBC ra normal count कितने बेटा? WBC ra normal count, normal WBC कितने? 4000 to 11,000 cubic millimeter cube. Right, this is the normal count of white blood cells, normal range for white blood cells, right? So option C is the correct answer right now. Next question देखिए बा. Question number 428, which test should be done before starting the isoniazid therapy to a patient? Which test should be done before starting the isoniazid therapy to a patient? Isoniazid, this is antitubercular drugs. This is antitubercular drugs. This is commonly used in TB patients. So, हमें कौन टेस्ट करेगा पड़ेगा बेटा? Liver function test, serum creatinine, serum electrolyte, and option D is none of these. So correct answer is option A, liver function test हमको करेगा पड़ेगा, है ना नहीं? AST, ALT, LFT ये सब हमको चेक करेगा पड़ेगा, है ना? Before starting the isoniazid therapy to a patient, right? Option A is the correct answer. Very good. Next question, question number 429 is a side effect of chloramphenicol drug. Side effect of chloramphenicol drugs. Option A is emotional reliability. Option B is bone marrow suppression. Option C is fever and cough. Option D is all of the above. So which option is the correct answer? Which option is the correct answer? बेटा फटाफट आंसर कर दिया. So correct answer is option B. Right? Option B is the correct answer. So chloramphenicol beta, this is a broad spectrum antibiotic, right? This is a broad spectrum antibiotic. Right? This is a broad spectrum antibiotics, and this is effect against various bacterial infections. But it has serious side effect, beta. It has serious side effects. That is bone marrow suppression, most serious causes. This is the bone marrow suppression. This is the most serious cause of chloramphenicals. Most serious cause or side effect of chloramphenicals. And how can we beta aplastic anemia? It can lead to aplastic anemia. Aplastic anemia, right? And pancytopenia हो बड़ा and pancytopenia भी होती है. Pancytopenia होते हुए. Pancytopenia कौन बेटा? Low RBC and WBC and platelets. हेला pancytopenia रे कौन है बेटा? Low RBC, low WBC and low platelets है हेला pancytopenia. So option B is the correct answer. Next question, question number 430, which is a common drug used during anaphylactic shock? Which is a common drug used during एनाफाइलेटिक शॉक मोस्ट इंपोर्टेंट एमसीक्यू डिस्कशन कर सारे मेनी टाइम्स हम डिस्कशन कर बार बार डिस्कशन कर क्वेश्चन ऑप्शन रही एडीआर और एपिनेफ्रिन ऑप्शन रही हाइड्रोकोर्टिजन ऑप्शन रही एट्रोपिन ऑप्शन रही डेक्सोना सो व्हिच ऑप्शन इज द करेक्ट आंसर फटाफट आंसर कर दो व्हिच इज अ कॉमन ड्रग यूज्ड ड्यूरिंग एनाफाइलेटिक शॉक व्हिच इज अ कॉमन ड्रग यूज्ड ड्यूरिंग एनाफाइलेटिक शॉक फटाफट आंसर कर दो फटाफट निर्भुल भाव रे जो गलत करेगा उसको उसको मार देंगे फटाफट मार खाएगा वो माड़ो खाइबा जी गलत करेगा से माड़ो खाइबा अरे सूर्य नारायण पति तमें टे क्वेश्चंस को पढ़ो बेटा उसके बाद आंसर करो which is a common drug used during anaphylactic shock अरे कावेरी मल्लिक तमें लेख ई क्वेश्चंस को लेखी खातर लेखी रख ई क्वेश्चंस आसी पाए कहला क्वेश्चंस आसुची जो मन को माने पड़ुनी नहीं नुआ क्वेश्चंस देखुछ खातर लिखिकी रख बेटा सो करेक्ट आंसर इज ऑप्शन ए है एड्रेनालिन और एपिनेफ्रिन एडीआर मींस एड्रेनालिन एड्रेनालिन को एपिनेफ्रिन मध्य कहा जाए राइट सो ऑप्शन ए इज द करेक्ट आंसर राइट ये क्वेश्चंस को गलत करेगा नहीं बेटा दिस इज द कॉमन ड्रग यूज्ड ड्यूरिंग एनाफाइलेटिक शॉक राइट एड्रेनालिन एपिनेफ्रिन राइट ना क्वेश्चंस माने रखो पूरा टिप ऑफ द टंग हमारे जे टिप ऑफ द टंग हमारे जे क्वेश्चंस देखो देखो आंसर हमारे जे राइट दिस इज द फर्स्ट लाइन ट्रीटमेंट ऑफ एनाफाइलेटिक शॉक्स राइट जदि किछि इंप्रूवमेंट हैला नहीं ताहले 5 आफ्टर 5 मिनट्स से आ गोटे डोज दे परिबा बेटा यू कैन एडमिनिस्टर सेकंड डोज आफ्टर 5 मिनट्स जदि इंप्रूवमेंट हैला नहीं राइट so option A is the correct answer next question number 431 which drug cause nausea and vomiting which drug cause nausea and vomiting option रही methotrexate option B रही reformation option C diclofenac option D रही domperidone so which option is the correct answer which drug cause nausea and vomiting which drug cause nausea and vomiting so correct answer कौन हबो option A methotrexate is the correct answer methotrexate is the correct answer तो जीआई प्रॉब्लम्स करिबो एंड नोजिया एंड वॉमिटिंग करेबो किए बेटा सो मोस्ट कॉमन साइड इफेक्ट ऑफ methotrexate सो को पेशेंट माने नियंती बेटा methotrexate rheumatoid arthritis पेशेंट माने नियंती राइट rheumatoid arthritis हाँ ना नहीं rheumatoid arthritis patient माने नियंती methotrexate and this drug cause nausea and vomiting because GI problems करेगा gastrointestinal tract problems करेगा so option A is the correct answer right next question number 432 रची degree in IM injection फटाफट आंसर कर दिला भूल करो ना बेटा एटा के भी तो भूल करबा नहीं के तमे नर्सिंग पाठ पढ़े ना बोले मु भाबे फटाफट आंसर कर दो फटाफट मो क्वेश्चंस रा आंसर करबे डिग्री इन IM इंजेक्शंस फटाफट आंसर करो विदिन ए सेकंड अरे समझते आंसर करो क्या यार आंसर ये वाला क्वेश्चंस को भी आंसर नहीं करते तुम लोग degree in IM injection 30 degree 45 degree 60 degree 90 degree so which option is the correct answer so correct answer is option D 90 degree नहीं तो को एरिया रे दिया होची IM injections intramuscular injections deltoid muscles of upper arm हाँ नहीं then gluteal muscles उठ बेटा the buttock रे हाँ नहीं then vastus lateralis muscles, vastus lateralis muscles, no, in thigh of infant, thigh of infants, right? These are all about IM injections, है ना? नहीं मैंने रख लिया तो को जगह IM injections हमें दो deltoid muscles, that is upper arm में दो gluteal muscle, that is in buttocks रे दो then thigh of infants, that is vastus lateralis muscles रे हमें दो IM injection, right? 90 degree. Next question number 433 injection oxytocin 1 ml ampoule contains how many units? देखिए जरा नहीं ऑक्सीटोसिन जो मैंने ऑफ्स गायने डिपार्टमेंट है ड्यूटी कला समय देखिए थी वो ऑक्सीटोसिन इंजेक्शन ऑक्सीटोसिन 1 ml ampoule contains how many units? ऑप्शन रही 10 यूनिट, ऑप्शन रही 5 यूनिट, ऑप्शन सी रही 15 यूनिट एंड ऑप्शन डी रही 20 यूनिट. जो मैंने काम कर फटाफट आंसर कर दिया. यूनिट तक खाली नो IU लिखा जाए, इंटरनेशनल यूनिट IU है ना, IU लिखा जाए थे नहीं, इंटरनेशनल यूनिट IU. So which option is the correct answer? One ml ampoule contain 1 ml ampoule contains कितने बेटा 10 units, 10 international unit. Option A is the correct answer, right? 10 units above. Option A is the correct answer. Pradeep the code. Option A is the correct answer. Next question, question number 434. Most common side effect of aspirin overdose. Most common side effect of aspirin overdose. Most important MCQ. What I go? Tinnitus. Option C is lacrimation. Option D is headache. सालिसिलेट पे लिखा ही था बेटा, एस्पिरिन रो अलगा ना कौन बेटा सालिसिलेट, एस्पिरिन और सालिसिलेट, राइट? सालिसिलेट, सालिसिलेट टॉक्सिसिटी. तो सालिसिलेट टॉक्सिसिटी हेले कौन हबा बेटा ऑडिटरी सिस्टम्स उपरे इफेक्ट पकइबो एंड दिस इज ऑलरेडी कॉज tinnitus, ringing haba, ringing in the ears, ringing in the ears haba beta, ringing in the ears means tinnitus, ringing in the ears, ringing in the ears. Option B is the correct answer. ana aspirin ra common side effect kona tinnitus. Next question, question number 435. Which is an example of tocolytic agent? Which is an example of tocolytic agent? Option is MgSO4, option is oxytocin, option C is ergot's derivative, option is Phenergan. So which option is the correct answer? फटाफट आंसर कर दियो. Tocolytic agents are medication used to suppress premature labor by inhibiting uterine contractions. है ना नहीं? So correct answer is a magnesium sulfate, MgSO4. This is a common tocolytic agent. It works to relaxing the uterine muscles and reducing contractions. Reducing contraction. You can't call it reducing contraction. Reduce contraction. How कौन करूँ बेटा uterine muscles को relax करूँ, uterine muscles को relax करूँ, right? So option A is the correct answer. Next question, question number 436. Prefer route of tranexamic acid drug administration. H option है subcutaneous, option which is IV, option which is IM, option which is ID. So which option is the correct answer? Subcutaneous, intravenous, intramuscular, intradermal. So which option is the correct answer? फटाफट आंसर करो जो मैंने ट्रानेक्सा देई थीबो. ट्रानेक्सा और ट्रानेक्सेमिक एसिड कहते हैं ना, ट्रानेक्सा और ट्रानेक्सेमिक एसिड. ट्रानेक्सा और ट्रानेक्सेमिक एसिड केमती दिया हुए या इंट्रावेनस, राइट? ऑप्शन बी इज द करेक्ट आंसर. समस्त को जाना थीबो है ना नहीं. ब्लड लॉस हेले हमें दोचे है ना नहीं, किसी जदि ब्लड लॉस हेला ब्लीडिंग होतो ताहले हमें दोचे ट्रानेक्सा आईवी दोचे, राइट? नेक्स्ट क्वेश्चन नंबर 437. लॉन्ग टर्म लिथियम यूज कैन कॉज, लॉन्ग टर्म लिथियम यूज कैन कॉज. ऑप्शन है रेनल फेलियर, ऑप्शन है लिवर फेलियर, ऑप्शन सी is heart failure, option is pneumonia. So which option is the correct answer? So long term lithium can use can cause renal failure. Option A is the correct answer, right? So lithium is the effective treatment for beta bipolar disorder रे हमें lithium therapy दोचे. bipolar disorder रे lithium therapy दोचे है ना. And this is the effective treatment for bipolar disorder. Option bipolar disorder पे हमें दोचे lithium therapy, right? है ना. आउ जदि long term lithium therapy दिया है ताहले तार कौन हबो renal failure हबो. Option is the correct answer. Next question number 438. Digoxin toxicity causes the perception of light color. Option is green, option which is red, option which is pink, option which is yellow. So which option is the correct answer? Most important MCQ. Digoxin toxicity causes the perception of light color. So which option is the correct answer? So correct answer is yellow beta, yellow dirty fellow. So option D is the correct answer. Digoxin toxicity causes the perception of light color, that is yellow. कौन हुए बेटा? हालोस है ना नहीं, हालोस अराउंड लाइट. कौन हुए? हालोस अराउंड लाइट ही जीवो एमती दिसिबो ताको ब्लरी विजन दिसिबो बेटा. ब्लरी विजन आउ कौन होची बेटा? एंड विजुअल हालुसिनेशंस मध्य हबो डिगॉक्सिन टॉक्सिसिटी द्वारा हैला. ये हैला क्वेश्चन नंबर 438 विषय रे. नेक्स्ट क्वेश्चन नंबर 439 is cough and hyperkalemia are the side effects of. Option is ACE inhibitors, option which calcium channel blocker, option C is potassium channel blocker, option which protease inhibitor. So which option is the correct answer? Cough and hyperkalemia are the side effect of angiotensin converting enzyme SE inhibitors. So option A is the correct answer. Option A is the correct answer. So this medication is used for high blood pressure and heart failure patient treatment by use करा जाए SE inhibitors. This is the class of medication commonly used for treating high blood pressures, right? High blood pressure पे use करा जाए and आउट पे use करा जाए heart failure पे use करा जाए, right? Heart failure पे use करा जाए, right? Option A is the correct answer. But next question number 440 is example of an inhalational anesthesia जो मैंने ओटी मना करे ड्यूटी करी थिबो से मैंने जानी थिबो. So option is ketamine, option which is sevoflurane, option C is methotrexate, option which is thiopental. So which option is the correct answer? Inhalational anesthesia and inhalational anesthesia. फटाफट आंसर कर दियो बेटा. So correct answer is option B, sevoflurane, desflurane, isoflurane, nitrous oxide and halothane. And these all are inhalational anesthesia. कौन कौन और बेटा? sevoflurane, right? Desflurane, right? ଆଉ କ'ଣ isoflurane, ଆଉ କ'ଣ ବେଟା nitrous oxide, and halothane, these all are about halothane, halothane. These all are about the example of inhalational anesthesia, right? Sevoflurane, desflurane, isoflurane, nitrous oxide, and halothane. These all are about inhalational anesthesia, right? So option B amara correct, right? This is an example of inhalational anesthesia. Next question number 441 beta. An example of reversible antiplatelet drug. An example of reversible antiplatelet drugs. Option D ticagrelor, option C clopidogrel, option C aspirin, option D streptokinase. So which option is the correct answer? So बेटा माइकार्डियल इन्फेक्शंस रे हमें दोचे नहीं कि एंटीप्लेटलेट ड्रग्स गुडा को दोचे है ना माइकार्डियल इन्फेक्शंस है माइ पेशेंट से दोचे नहीं कि लोडिंग डोज दिया होती ना माने रहते चे लोडिंग डोज कितने दिया है बेटा 380 एस्पिरिन क्लोपिड एंड एटोर्वा माने ना क्लोपिड aspirin, clopid, and etorva दिया होचे 380. This is the loading dose for myocardial infarctions, right? So an example of reversible antiplatelet drug. Which option is the correct answer, beta? So correct answer is which options? Option A. Option A is the correct answer. This is the reversible antiplatelet drug, beta. Ticagrelor, right? Option A is the correct answer. एंटीप्लेटलेट जदि पचारि था खाली एंटीप्लेटलेट जदि पचारि था बेटा इरिवर्सिबल जदि पचारि था ताहले क्लोपिडेरल ही था, राइट? इरिवर्सिबल इट रिवर्सिबल एंटीप्लेटलेट ड्रग इज टिकाग्रेलर एंड दिस इज इरिवर्सिबल बेटा इरिवर्सिबल एंटीप्लेटलेट drug, right? Clopidogrel is the irreversible antiplatelet drug, right? So हमें myocardial infarction रे loading dose दो 300 380 aspirin 300 clopidogrel 300 and etorva 80 दिया होचे, right? This is the management of myocardial infarctions. So option E is the correct answer. But next question number 442. What precautions should be kept in the mind while administering phenytoin? Option A IV administration should not exceed a rate of 50 milligram per minute. Option B IV administration should not exceed a rate of 50 microgram per unit. Option C IV administration should not exceed a rate of 25 per minute. Option D IV administration should not exceed a rate of 25 microgram per minute. So which option is the correct answer? फटाफट आंसर कर देना. So which option is the correct answer? फटाफट आंसर कर दो. So correct answer is beta option A is the correct answer. Option A is the correct answer. IV administration should not exceed a rate of 50 milligram per minute is the correct answer, right? This is for the adult. This is for adult beta, right? While administering phenytoin in adults, IV administration should not exceed a rate of 50 milligram per minute. In pediatrics, beta, हमें केमिति देखो not exceeding in pediatrics. In pedia is not exceeding 1 to 3 milligram per kg per minute, right? Or 50 milligram per minute, right? It is not exceed above 1 to 3 milligram per kg per minute or 50 milligram per minute, whichever it is a slower rate रे दिया कि जोर rate रे भी दिया, right ना. So correct option कौन होगा हमारा? Option A is the correct answer, right? Next question, question number 443. Which of the following most common side effect of clozapine? So most common side effect of clozapine कौन बेटा? Option A neutropenia, option B thrombocytopenia, option C pancytopenia, option D all of the above. So which option is the correct answer? So neutropenia is the most common side effect of clozapine, right? Neutropenia is the most common side effect of clozapines. Next question देखिबा. Question number 444 अछि. Anti sensitivity test AST करछे ना before giving कौन बेटा? Before giving antibiotics. So anti-sensitivity test AST should be done via intradermal route because option A it diffuse slowly, option B it diffuse quickly, option C it is less painful, option D is easy to administration. So which option is the correct answer? Sensitivity test करूचे ना बेटा, antibiotic sensitivity test करूचे ना. So correct answer is option A, it diffuses slowly, right? The anti-sensitivity test or AST is performed through intradermal route and it allows for slow diffusion of the injected substance, right? Injected substance or injected medications. Next question, question number 445. Tramadol is a example of option which anti-emetic, antipyretic, option which antipyretic, option which opioid analgesics, option which PPIs. So which option is the correct answer? Very good, option C is the correct answer, opioid analgesics, right? Tramadol is an example of opioid analgesics. Option C is the correct answer. Very good. Next question, question number 406. Most common adverse effects of ADR. Option A bradycardia, option B tachycardia, option C tachypnea, option D bradyphenia. So which option is the correct answer? फटाफट आंसर कर देला. Most common adverse effects of ADR. Option is bradycardia, tachycardia, tachypnea, bradyphenia. So which option is the correct answer? So epinephrine common adverse effect कौन बेटा? Tachycardia. Option B is the correct answer, right? एड्रेनालिन को बार बार कहते बेटा एडीआर और एड्रेनालिन को कौन कहती? एपिनेफ्रिन कहते. मन रखी था भूली जीवनी. टाकीकार्डिया हम बेटा आउ कौन हम बेटा? हाइपरटेंशन हम, हाइपरटेंशन हम आउ कौन हुए? हेडेक हम, राइट? एंजाइटी डायफोरेसिस सब हम, एंजाइटी डायफोरेसिस, राइट? नोजिया हम, वॉमिटिंग हम, नोजिया हम, वॉमिटिंग हम, वीकनेस आसीबा पेशेंट को, वीकनेस एंड आउ कौन हम? ट्रेमर्स हम. This is all about the common adverse effect of adrenaline or epinephrine, right? Next question, question number 447. Trihexyphenidyl act as a option is antipsychotics, option is anti-Parkinsonism, option C is olanzapine, option D is phenytoin. So which option is the correct answer? फटाफट आंसर कर दे. Trihexyphenidyl THP कहते ना कि THP वो मैंने साइकियाट्रिक डिपार्टमेंट ड्यूटी कर टीएचपी वाले मेडिकेशन सुनी थी बा. टीएचपी ट्राइहेक्सिफेनिडाइल टीएचपी दिस इज एंटीसाइकोटिक, एंटी-पार्किंसोनिज्म, ओlanzapine और फेनिटोइन. सो व्हिच ऑप्शन इज द करेक्ट आंसर बेटा? So correct answer is option B, anti-Parkinsonisms. Right? This is anti-Parkinsonisms medications. And या को और भी कौन कहते बेटा एंटी स्पैज्मोडिक ड्रग्स भलिया काम करे टू ट्रीट स्टिफनेस ट्रेमर स्पैजम और पोर मसल्स पार्किंसंस डिजीज रे हमें दौचे ए मेडिकेशंस को राइट और भी कौन कहते एंटी मिस्करनिक्स कहते बेटा दिस इज द क्लास व्हिच मेडिकेशंस क्लास रे आउची बेटा एंटी मिस्करनिक्स एंटीमिस्कैरेनिक्स या कौन पे यूज करा जाए बेटा एक्स्ट्रा पिरामिडल सिम्पटम्स को मैनेज करबा पय ईपीएस मैनेज करबा पय ए टीएचपी दिया हुए दिस मेडिकेशन यूज फॉर द मैनेजमेंट ऑफ एक्स्ट्रा पिरामिडल सिम्पटम्स ईपीएस एक्स्ट्रा पिरामिडल सिम्पटम्स एक्स्ट्रा पिरामिडल सिम्पटम्स को मैनेज करबा पय टीएचपी दिया हुए राइट नेक्स्ट क्वेश्चन नंबर 448 रही बेटा acetyl salicylic acid should be avoided in which condition acetyl salicylic acid should be avoided in which condition option is bacterial fever option B is viral fever option C is headache option which is none of the above so which option is the correct answer फटाफट आंसर कर दिया acetyl salicylic acid should be avoided in which conditions acetyl salicylic acid को कौन कहते बेटा एस्पिरिन कहते एस्पिरिन को एसिटिलिक सैलिसिलिक एसिड कहती है ना नोन एज एस्पिरिन तो करेक्ट आंसर होगा बेटा ऑप्शन बी दिस इज द कंडीशन वी अवॉइडेड द एस्पिरिन ड्रग्स एंड अदरवाइज रेस सिंड्रोम हवा चांस थे रिस्क ऑफ रेस सिंड्रोम होगा बेटा सी पे वी आर अवॉइडिंग द aspirin drugs in viral fever and this can damage to brain and liver cells this can damage the brain and liver cells next question number 449 अछि most common side effect of chloromphenical drug most common side effect of chloromphenical drug option is bronze baby syndrome option is gray baby syndrome option is red baby syndrome option D is A and B so which option is the correct answer beta फटाफट आंसर कर देलो which option is the correct answer फटाफट आंसर कर दो तो ब्रोंज बेबी सिंड्रोम कोतरे हेता है बेटा फोटोथेरापी रे हेता है ना फोटोथेरापी रे हेता है ब्रोंज बेबी सिंड्रोम माने रखता फोटोथेरापी रे हेता है ब्रोंज बेबी सिंड्रोम सो ग्रे बेबी सिंड्रोम कोतरे हेता है एंड रेड बेबी सिंड्रोम कोतरे हेता है बेटा पार्वोवायरस B19 इन्फेक्शन रहता है रेड बेबी सिंड्रोम पार्वोवायरस B19 इन्फेक्शंस right so which option is the correct answer so correct answer is option B रे हेता है grave baby syndrome is the side effect of chloromphenical drugs right option B is the correct answer फटाफट आंसर कर दिया मन रखे था इस क्वेश्चंस को लिख के रखे था बेटा जो मैंने जाना रेड वैंकोमाइसिन्स अच्छा ହେଲା बेटा vancomycin रे नहीं कि नट अकर्स रेड बेबी सिंड्रोम कौन हो रही है रेड मैन सिंड्रोम हुए बेटा भेंको मान रखी था भेंकोमाइसिन रे कौन हम रेड मैन सिंड्रोम हुए रेड मैन सिंड्रोम हुए नट रेड बेबी सिंड्रोम बेटा राइट भेंकोमाइसिन रे कौन हुए रेड मैन सिंड्रोम हम नट रेड बेबी सिंड्रोम vancomycin infusion reactions हेले vancomycin infusion reactions हेले बेटा रेड मैन सिंड्रोम हम राइट डिफरेंट ना बेटा ऑब्वियसली डिफरेंट नेक्स्ट क्वेश्चन क्वेश्चन नंबर 450 central line fluid administration through option which is left subclavian vein option which is right subclavian vein option which is right subclavian artery option which is jugular artery central line fluid administration through option which is left subclavian vein option which is right subclavian vein option which is right subclavian artery option which is jugular artery so which option is the correct answer so correct answer is beta option B, right subclavian vein, right? Central line fluid administration through right subclavian and commonly inserted in the subclavian vein that is right to left, right now. So option B is the correct answer, beta. Next question, question number 455, 451 is expected outcome of dopamine H. Option H, decreased blood pressure. Option which is reducing peristalsis. Option which is increased blood pressure. Option which is none of them. So which option is the correct answer? फटाफट answer कर दे. Which option is the correct answer? Which option is the correct answer? Expected outcome of dopamine H. Option which is decreased blood pressure. Option which is reducing peristalsis. Option C which increases blood pressure. Option D which is none of them. So which option is the correct answer, beta? Which option is the correct answer? So correct answer is option C, increases blood pressure. Next question, question number 452. While administering ear drops in 2 years old child, which of the following is done by the nursing officer while giving ear drops or ear pina each? Most important MCQ. हम discussion कर सारे फटाफट आंसर करो. While administering ear drops in 2-year-old child, which of the following is done by the nursing officer while giving ear drops, ear pina each? Upward and forward. Option B is normal positions. Option C is backward and downward. Option D is forward and downward. So which option is the correct answer? बेटा फटाफट आंसर करो. फटाफट आंसर करो बेटा. Which option is the correct answer? Very good. Option C is the correct answer. जो मैंने जाने ना बेटा ताकू खातारे नोट डाउन करके रखा. इटा मोस्ट इंपोर्टेंट MCQ गुड़ा का राइट. मोस्ट मु 5 स्टार जो जोड़ा दौच ना कि मोस्ट इंपोर्टेंट है तुमको जब फर्स्ट टाइम देखुच निहाती भाव में नोट डाउन करवा उचित. हेलो अच्छा कि मेडिसिन स्टोर रे कैल्शियम एंड विटामिन D3 तो मेसेज कर व्हाट्सएप कर दूची व्हाट्सएप करूचे. ଟିକେ ପଚାର ତାପରେ ମତେ କୁହ। जस्ट अ मिनट बेटा। Okay, next question. Question number 453 is sign of digoxin toxicity. Option is constipation, option is headache, option is blurring of vision and diphlopic, and option is diarrhea. Sorry for interruption, beta. Hello. WhatsApp करछी देखो ब्रदर। देखो ना तमे तुमर मोबाइल डाटा ऑन करना के देख लो। रोहित सर ने करेक्ट आंसर फटाफट आंसर कर देलो। So correct answer is option C, right? Blurring of vision and diplophic of it. Diplophic, dual vision, that's a double vision. Hello. हाँ ठीक अच्छे। So question number 404 is an example of monoclonal antibodies. Option A rifaximin, option B rituximab, option C indinavir, option D judovida. And so which option is the correct answer? Correct answer beta rituximab, right? Rituximab This is a monoclonal antibody and used in various conditions like non-Hodgkin lymphoma रे यूज करा हुए बेटा, autoimmune disease रे यूज करा जाए, right? Non-Hodgkin lymphoma रे यूज करा जाए, non-Hodgkin lymphoma रूटेक्सिमैब दिया हुआ बेटा, right? Next question, question number 455. A client is receiving mannitol. The nurse assesses the client for evidence of which clinical problem for which the client at risk. Option D dehydration, option which is somnolence, option C tinnitus, option D fatigue. So which option is the correct answer? So correct answer beta कौन होगा? Dehydration. Why client is receiving mannitol, the nurse assesses the client for evidence of which clinical problem for which the client at risk, that is dehydration, right? Option A is the correct answer beta. Next question, question number 456 रची famotidine work age, option रची option A रची histamine 2 receptor blocking agent, option B रची histamine 2 inducing agent. Hello, नहीं 1500 कितने कितने रहा 1000 नहीं 1000 वाला थी बजे थी पचा हाँ हाँ मिसी की कम कंपोजिशंस वाला हाँ 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 1000 प्लस 500 सेटा मत फोटो उठिक पठा ना मागिक मार्क हाँ So which option is the correct answer beta? Famotidine work as a histamine 2 receptor blocking agent, option B is histamine 2 inducing agent, option C is photon pump inhibitor, option D is neutralize the HCl. So which option is the correct answer beta? So correct answer is option A beta, histamine 2 receptor blocking agent. Next question, question number 457 is which medications should be in nurse applied topically in second and third degree burns to treat bacterial and yeast infection? Option is bismuth subsalicylate, option B is gold sodium thiomalate, option C is silver sulfadiazine, option D is arsenic trioxide. So which option is the correct answer beta? So correct answer is option C, silver sulfadiazine, right? Silver sulfadiazine is the correct answer. This is approved for the treating and preventing infections in second and third degree burns, right? So option C is the correct answer. But the next question, question number 458, what is the major nursing responsibility when administering sulfolamide preparation? What is the major nursing responsibility when administering sulfolamide preparation? Option A, monitoring child's temperature. Option B, wait the child daily. Option C, give milk with medications. Option D, administer the drug prescribed time. So which option is the correct answer? So which option is the correct answer beta? So फटाफट आंसर करो. So correct answer is administer the drug prescribed times. Right? Option D is the correct answer. Next question. Next question, question number 459. This agent decreases intestinal muscles tone to slow passage of feces. Option A hypertonic. Option B cathartics. Option C laxatives. Option D antidiarrheal opiate agents. So which option is the correct answer? sorry for interruptions, right? So which option is the correct answer? This agent decrease intestinal muscle tone to slow passage of feces. Option A hypertonic, option B is cathartic, option C is laxative, option D is antidiarrheal opiate agent. So which option is the correct answer? Option D is the correct answer, beta. Next question, question number 460. Which drug can be given in empty stomach? Thyroxine, pantoprazole, both. Option D is none. So which option is the correct answer, beta? So correct answer is option B, beta. Sorry, beta. Stop hochi. Next question, question number 461 achi. Patient is on thyroxine. What is the cheap and best way to monitor drug dose? Option A is T3 level, option B is T4 level, option C is TSH level, option D is non. So which option is the correct answer? So correct answer is beta option C, TSH level, right? The correct answer is option C. Next question, question number 462 is beta. Tocolytic drugs are such drug which option is increase GI motility, option which increase uterine motility, option C is reduce uterine motility, option D is reduce GI motility. So which option is the correct answer? So correct answer is beta option C, reduce uterine motility. So option C is the correct answer. Tocolytic drugs are such drugs which reduce uterine motility, right? Next question. Question number 463 is beta. The drug of choice for treatment of filarias is. The drug of choice for treatment of filarias is. Option A tetracycline, option B amphetamine, option C is dapsone, option D is diethyl carbamazine citrate. So which option is the correct answer? The correct answer is beta amphetamine. So amphetamine, this is the drug of choice for treatment of filaria, right? Sorry, beta. Option D is the correct answer, right? Diethyl carbamazine citrate is the drug of choice for treatment of filarias, right? So option D is the correct answer. Option D is the correct answer. Option D is the correct answer, beta. Very good. Diethyl carbamazine citrate is the drug of choice for treatment of filaria. Treatment of filaria, DEC. Right, DEC, diethyl carbamazine citrate is the drug of choice for treatment of filaria. Next question, question number 464. The dosaliform therapy is indicated in option which acute टॉक्सिकेशन ऑप्शन बी कैनाबिस डिपेंडेंस ऑप्शन सी एंजाइटी डिसऑर्डर ऑप्शन डी रहे क्रोनिक अल्कोहलिज्म सो फटाफट आंसर कर दे बेटा फटाफट आंसर करो फटाफट आंसर करो जस्ट अ मिनट बेटा कौन बेटा करेक्ट आंसर है ऑप्शन डी क्रोनिक अल्कोहलिज्म रे मेडोसल फॉर्म थेरेपी दो जाना नहीं नेक्स्ट क्वेश्चन द एंटीडोट ऑफ वारफेरिन एच कौन है बेटा करेक्ट आंसर इज ऑप्शन बी विटामिन K1 राइट प्रोटामिन सल्फेट विटामिन K हेपारिन एसिटिल सिस्टाइन सो करेक्ट आंसर इज ऑप्शन बी राइट द एंटीडोट ऑफ वारफेरिन इज विटामिन K नेक्स्ट क्वेश्चन आंसर करो बेटा फटाफट Which of the following drug is used for the dilation of pupil? Tropicamide, option B is betamethasone, option C is levofloxacin, option D is gentamicin. So which option is the correct answer beta? Sorry beta interruption सोची मझिरे और interruption solve है right हम continuous discussion करेगा. So which option is the correct answer beta? Correct answer is tropicamide beta. Tropicamide this is the drugs is used for the dilation of pupil right? Dilation of pupil. Dilation of pupil को कौन कहते हैं बेटा mydriasis कहते हैं right mydriasis is the dilation of pupil right next question number 467 the drug used to constrict the pupils the drugs used to constrict the pupil constriction of the pupil को कौन कहते हैं बेटा constrictions of pupil को मायोसिस कहते मायोसिस डायलेशन ऑफ पीपल को कहते माइड्रासिस कंस्ट्रिक्ट द पीपल्स को कहते मायोसिस राइट सो ऑप्शन है माइडियाटिक्स ऑप्शन बी रहे सल्फोनामाइड्स ऑप्शन सी एंटीबायोटिक्स ऑप्शन नीचे मायोटिक्स सो व्हिच ऑप्शन इज द करेक्ट आंसर द ड्रग यूज्ड टू कंस्ट्रिक्ट द पीपल्स और व्हिच ऑप्शन इज द करेक्ट आंसर फटाफट आंसर कर दियो करेक्ट आंसर है बेटा मायोटिक्स Myotics is the correct answer right? Next question number 468 रची बेटा, which of the following drug is a proton pump inhibitors? Option A ranitidine, option B रची famotidine, option C रची pantoprazole, option D रची sucralfate. Which option is the correct answer? Which option is the correct answer beta? Which option is the correct answer? जो बोलेगा वो बनेगा नर्सिंग ऑफिसर्स। कौन बनेगा नर्सिंग ऑफिसर बेटा? वही आंसर करेगा। कौन बनेगा नर्सिंग ऑफिसर? सो व्हिच ऑप्शन इज द करेक्ट आंसर? फटाफट आंसर कर दे बेटा। Which of the following drug is a proton pump inhibitor? So which option is the correct answer? So correct answer is pantoprazole is a proton pump inhibitors, PPI. Proton pump inhibitors, PPI. Next question number 469 is the route of administration of hepatitis B vaccine is option A intramuscular, option B subcutaneous, option C intrathecal, option D intradermal. So which option is the correct answer? Which option is the correct answer? So correct answer is beta intramuscular. So hepatitis B vaccine always given is the route of administration like intramuscular, right? Intramuscularly ही दिया हुए बेटा, right? सो एडल्ट्स रे को एरिया रे दिया हुए बेटा, एडल्ट्स मान को एरिया रे दिया हुए बेटा, डेल्टॉइड मसल्स रे दिया हुए, डेल्टॉइड मसल्स रे दिया हुए विटामिन सॉरी हेपेटाइटिस बी वैक्सीनेशन एंड पीडियाट्रिक्स रे एंड चिल्ड्रन रे को थ्री दिया हुए बेटा, को एरिया रे दिया हुए हेपेटाइटिस बी वैक्सीन एंटेरोलेटरल थायरे दिया हुए बेटा, राइट? एंटेरोलेटरल थायरे दिया हुए इन चिल्ड्रन और for infants beta, right? Next question number 470 rachi beta, which of the following medication orders are for every other day? Which of the following medication orders are for every other day? Option A rachi QOD, option B rachi QH, option C rachi QD, option D rachi BID. So which option is the correct answer beta? So correct answer is beta option A is the correct answer. Every other day QOD, every other day. Anna every other day QOD. QH कौन बेटा? QH, what is QH? Every hour. QD कौन बेटा? QD, what is QD? Every day QD. BID कौन बेटा? BID, what is BID? Twice a day. This is all about the medications orders. Next question number 471. Patient is to receive 1000 ml of IV fluids in 6 hours. The drop factor is 15 drops per ml. At approximately how many drops per minute should the flow rate be set? Option D 42 drops per minute, option B 21 drops per minute, option C 55 drops per minute, option D 33 drops per minute. So बेटा आमे जानी थिले फ्लो रेट रो फॉर्मूला काली आमे डिस्कशन बहुत गुडे कैलकुलेशन करथिले। फ्लो रेट इक्वल टू टोटल वॉल्यूम इन ml into drop factor divided by total time in minute, total time in minutes, right? So कितने कौन देची बेटा? 1000 ml देची, नहीं 1000 ml देची। ड्रॉप फैक्टर कितने बेटा? ड्रॉप फैक्टर 15 ड्रॉप्स देची, 15। देन टोटल टाइम कितने बेटा? 6 आवर देची, 6 आवर 6 इंटू कितने बेटा? 60 है ना? मिनट से जो हमें कैलकुलेशन करेगा 6 इंटू 60 है ना? नहीं कितने ही गला बेटा? 15,000 डिवाइडेड बाय 360 है ना? नहीं कितने आसबो बेटा? 41.67 आसीबो, 41.67 आसीबो, 41.67 ड्रॉप्स पर मिनट है ना? नहीं एतिकी आसीबो, कैलकुलेट करके देखो। सो अप्रोक्सीमेटली केते 42 ड्रॉप्स पर मिनट है ना? नहीं 41.67, that is approximately 42 drops per minute. So option A is the correct answer. Option A is the correct answer, right? Now next question. Question number 472 is route of Mantoux skin test. Most important MCQ. Route of Mantoux skin test. Option is intradermal ID. Option B is intramuscular IM. Option C is intravenous IV. Option D is subcutaneous SC. So which option is the correct answer? आने already discussion करी सारे चे हाँ ना नहीं. So Mantoux test जो करा होची बेटा सितरे small amount of कौन थे? Small amount of PPD थे, right? Small amount of PPD कौन सीटा purified protein derivative थे. Purified protein derivative. हाँ ना नहीं. ताको हमें इंट्राडॉर्मली देकी टेस्ट करे था हाँ ना नहीं AST एंटीस हमें कहते ना AST करे था ना इंट्राडॉर्मली स्किन टेस्ट और ट्यूबरकुलिन टेस्ट को है ना इंट्राडॉर्मली करा जाए बेटा. ऑप्शन ए इज द करेक्ट आंसर. वेरी गुड जो मैंने आंसर कर 473 फॉलोअर MI attack streptokinase used for what purpose? Option A thrombolytic, option B analgesics, option C antiplatelets, option D anticoagulants. So which option is the correct answer? So correct answer is thrombolytic. This is streptokinase is a thrombolytic agent, right? It helps to dissolve blood clot. It helps to dissolve blood clots, streptokinase, right? So this is a thrombolytic agent. So option A is the correct answer. Next question, question number 474. Ideal dose of intramuscular injections, beta, most important MCQ. Ideal dose of intramuscular injections. Which option is the correct answer? 2 ml, 3 ml, 5 ml, 10 ml. So ideal dose. Oh, the beta. Ideal dose of intramuscular injections. Ideal dose of IM injections. आंसर करो बेटा, फटाफट आंसर करो. So correct answer is 3 ml beta. Option B is the correct answer, right? And maximum dose कितने बेटा? maximum dose of IM injections. एटा भी आसे बेटा. ठीक है, जाने से आंसर कर दिया बेटा. Maximum dose of IM injection, single dose. आंसर करो बेटा, फटाफट आंसर करो. जो मैंने जाना अच्छे आंसर करो. मैक्सिमम डोज ऑफ IM इंजेक्शंस कितने ml बेटा? फटाफट आंसर करो. कितने ml? आई वांट टू नो, जाना पाई चाहूँ. मैक्सिमम डोज ऑफ IM इंजेक्शन सिंगल डोज. वेरी गुड. 5 ml, राइट? 5 ml है ना? नहीं 5 ml है बता. वेरी गुड. 5 ml का बेटा मैक्सिमम डोज ऑफ IM इंजेक्शन इन एडल्ट्स ओनली. दिस इज फॉर एडल्ट्स. Right, next question, question number 475. Aspirin can be given with which fluid? Option A milk, option B orange juice, option C water, option D coffee. So which option is the correct answer? So correct answer is beta option C, water. Aspirin is commonly take with water, right? Option C is the correct answer. Next question, question number 476. A patient blood pressure suddenly dropped. Which drug will be ordered by doctor? Option A dopamine, option B PCM, option C atropine, option D amlodipine. So which option is the correct answer? Which option is the correct answer? Which option is the correct answer, beta? So correct answer is dopamine, right? A patient blood pressure suddenly dropped. Which drug will be ordered by doctor? Dopamine. Option A is the correct answer. Next question. Question number 477 ଅଛି बेटा. Which is the heparin antidote? Which is the heparin antidote? बार बार हम डिस्कशन करुचे. Which option is the correct answer? फटाफट आंसर करो बिना भूल रहे. ऑप्शन ए नैलोक्सोन, ऑप्शन बी प्रोटामिन सल्फेट, ऑप्शन बी ऑप्शन सी एमएल नाइट्रेट, ऑप्शन डी सोडियम बाइकार्बोनेट. सो व्हिच ऑप्शन इज द करेक्ट आंसर? फटाफट आंसर करो बेटा, फटाफट आंसर कर दे. जो मैंने पर्यंत वीडियो को लाइक करना फटाफट वीडियो को लाइक मध्य कर दियो एवं वीडियो को शेयर कर दियो एवं चैनल को यदि फर्स्ट टाइम देखो निहाती भाव में चैनल को सब्सक्राइब कर दियो बेटा. प्लीज 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 इट्स my humble request to one and all, please subscribe the channel. So correct option habo protamine sulfate, right? Most important MCQ heparin antidote होची protamine sulfate. हमें बार बार ये क्वेश्चंस को पढ़ो छे निहाती भाବରେ माइंड रे सेव हे जिबा उचित, राइट? नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 478 अछि एंटी एमेटिक्स आर एडमिनिस्टर्ड टू. ऑप्शन अछि रिड्यूस पेरिस्टालिसिस, ऑप्शन बी अछि रिड्यूस पेन, ऑप्शन सी अछि रिड्यूस सीजर, ऑप्शन डी अछि रिड्यूस वॉमिटिंग. सो कौन पाई एंटी एमेटिक्स मेडिकेशन से एडमिनिस्ट्रेशन करा जाए? सो व्हिच ऑप्शन इज द करेक्ट आंसर? फटाफट आंसर कर दिया, फटाफट आंसर कर दिया बेटा, फटाफट आंसर करो. सो करेक्ट आंसर इज ऑप्शन डी इज द करेक्ट आंसर, रिड्यूस वॉमिटिंग, राइट? एंटी एमेटिक्स ड्रग्स यूज्ड टू रिड्यूस वॉमिटिंग, right? Next question, question number 479 अछि बेटा. Nurse advised to administer injection metronidazole to a patient. See note action of this each. Option A analgesics, option B antipyretics, option C antibiotics, option D sedatives. So nurse advised to administer injection metronidazole to a patient. See note action of this each. Option H analgesics, option which antipyretics, option C antibiotics, option D sedatives. So which option is the correct answer? So correct answer is very good, very good, very good, very good. Ayushman, Ayush C, Suman Minch, Pradeep Tagoda, Surya Narayanpati, Tanushri Pohan, Mamata Nag, Reena Kishans, Surya Narayanpati, Small Birds, Priyanka Jaina, Girish Mahapatra. Option C only correct answer. तमे माने आंसर C कहला माने आंसर सी ही करेक्ट हबो बेटा. वेरी गुड, ऑप्शन सी इज द करेक्ट आंसर. नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 480 अछि बेटा. Patient came to emergency department unconscious with pinpoint pupil. Patient come to emergency department unconscious with pinpoint pupil, lacrimation and history of substance abuse. Which of drug will be administered? Which of drug will be हमें कोई drugs तंको दवा. Patient ऐसे emergency department को unconscious है कि pinpoint pupil ने कि lacrimation सोची बेटा and history of substance abuse. So which option is the correct answer? Option A flumazenil, option B naloxone, option D C lorazepam, option D naltrexone. So which option is the correct answer? Which option is the correct answer बेटा? आंसर कर दो फटाफट. सो करेक्ट आंसर हबो नैलोक्सोन हबो. वेरी गुड, वेरी वेरी गुड. ऑप्शन बी इज द करेक्ट आंसर, राइट? सो ओपियोइड ओवरडोज रा एंटीडोट हैला नैलोक्सोन, राइट? सो सब्सटेंस एब्यूज है कि ऐसी हिस्ट्री ऑफ सब्सटेंस एब्यूज है ये कि ऐसी. तो यार एंटीडोट कौन है बेटा? एंटीडोट्स होच नैलोक्सोन. ओपियोइड ओवरडोज, ओपियोइड ओवरडोज हेची हा ना नाही. सब्सटेंस एब्यूज हेची मींस ओपियोइड ओवरडोज हेची. सो ओपियोइड इंटॉक्सिकेशन हेची. तो यार एंटीडोट कौन? नैलोक्सोन. सो नैलोक्सोन इज द करेक्ट आंसर. ऑप्शन B is the correct answer. Next question, question number 481. Patient has undergone donor nephrectomy. Patient has undergone donor nephrectomy. The drug will not be given. The drug will not be given. Option A is morphine, option B is fentanyl, option C is paracetamol, option D is diclofenac. So correct answer कौन होगा बेटा? Diclofenac. This is a non-steroidal anti-inflammatory drugs. आना नहीं. And it can damage the kidney, but again it can damage the kidney. It can damage the kidney. है ना नहीं यार? side effect अच्छी बेटा, it can damage kidney, है ना नहीं? So option D is the correct, and this drug will not given to the donor nephrectomy undergone donor nephrectomic patients, right? Next question number 482. Patient is allergic to B-lactamase, and which of following drug is safe to administer? Option A amoxicillin, option B penicillin, option C vancomycin, option C cefazolin. So which option is the correct answer? So correct answer is beta option C is vancomycin. When a patient allergic with beta lactamase, है ना नहीं? Beta lactamase. So which drug safe is administration? That is vancomycin is safe to administer. This is beta narrow spectrum. This is narrow spectrum. This is narrow spectrum bactericidal antibiotics, right? And this is used to treatment of staphylococcal infection. Staphylococcal infections by यूज करा जाउछ, राइट? स्टाफिलोकोकल इन्फेक्शंस by यूज करा जाउछ बेटा, राइट? वैंकोमाइसिन कौन पे यदि सीरियस स्टाफिलोकोकल इन्फेक्शन हेतिबो ताहाले हमें वैंकोमाइसिन द्वारा ट्रीटमेंट करछ, हन नै? Next question number 483 अछि बेटा. Patient with DVT is advised low molecular heparin. At which site nurse will administer this? Patient with DVD when thrombosis is advised low molecular heparin LMWH, low molecular weight heparin. LMWH को ना low molecular weight heparin. At which site nurse will administer this? Option A subcutaneous, option B IM, option C oral, option D IV. So which option is the correct answer बेटा? बेटा लो मॉलिक्यूलर वेट हेपारिन केमती दिया हुए? सबक्यूटेनियस दिया हुए बेटा, सबक्यूटेनियस देखिए ना कि केबे सबक्यूटेनियसली दिया हुए. LMWH लो मॉलिक्यूलर वेट हेपारिन LMWH सबक्यूटेनियसली दिया हुए बेटा. This is an anticoagulant. LMWH anticoagulant, right? अब कौन करा हुए बेटा डीवीटी रे कंप्रेशन स्टॉकिंग्स पिंदा हुए ना, कंप्रेशन स्टॉकिंग्स वो LMWH दिया हुए, right? This is the management of DVT. Next question number 484. Jet track intramuscular technique is used to administering which kind of medications? Jet track intramuscular technique is used in administering which kind of medications? Option which dark color medication, option which long term use medications, option which medications more than 5 ml, option D medication that have a long absorption time. Most important MCQ exam मानकरे आसुची. This is very important MCQ बेटा, 5-star question. So which option is the correct answer? फटाफट आंसर कर दिया. So correct answer is which option? So jet track intramuscular technique रे कौन पे दिया हुआ है बेटा? Prevent to leaking the drugs. Prevent to leaking the drugs. से पे दिया हुआ jet tracks रे. Prevent to leaking, leak हवने बोली. Prevent to leaking the drugs, right? से पे हमें jet track पे 2 injections, right? So correct option is option A बेटा. Correct answer is option A. Dark color medications हमें जेट इंट्रामस्कुलर टेक्निक रे ही दिया हो बेटा, राइट. सो ऑप्शन ए इज द करेक्ट आंसर. नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 482. 2 tablespoon are equivalent to how many milliliters or ml? ऑप्शन ए 30 ml, ऑप्शन बी 25 ml, ऑप्शन सी 40 ml, ऑप्शन डी 10 ml. सो फटाफट आंसर करो बेटा. नो डिस्कशन बिटवीन इन बिटवीन बेटा, निजे निजे भीतर डिस्कशन करो नि, क्वेश्चन रो आंसर करो, राइट बेटा. 2 tablespoon are equivalent to how many milliliters? So one tablespoon equal to बेटा 15 ml है ना. नहीं, 2 tablespoon equal to कितना होगा? 30 ml होगा, है ना. नहीं, 30 ml होगा. So option A is the correct answer. Next question, question number 486. Which drug is effective for iron chelation therapy in beta thalassemia? Options A रची dextromethorphan, ऑप्शन बी છે डेफ्रुक्सामिन, ऑप्शन सी છે इम्यूनोग्लोबुलिन्स, ऑप्शन डी છે ट्राइमेथोफ्रेम. सो व्हिच ऑप्शन इज द करेक्ट आंसर? बेटा फटाफट आंसर कर देला. यू वांट टू नो योर आंसर. व्हिच ड्रग इज इफेक्टिव फॉर आयरन चिलेशन थेरेपी इन बीटा थैलेसीमिया? सो करेक्ट आंसर है डेफ्रुक्सामिन बेटा. So option B is the correct answer. Defruxamine is the correct answer. This is a non-toxic iron chelation therapy in beta thalassemia. Right. Next question, question number 487. What is the appropriate needle gauge for intradermal injection? Most important MCQ. यही सब वही questions आसे पर बेटा. What is the appropriate needle gauge for intradermal injections? Option A 16 to 18 gauge, option B 19 to 23 gauge, option C 24 to 26 gauge, option D 20 to 22 gauge. So which option is the correct answer beta? So correct answer is which option? So correct answer is beta which option? So correct answer is option C. Option C is the correct answer. Very good, very good. So option C is the correct answer. 24 to 26 gauge needle use करा जाओ चे intradermal injection से, right? Next question, question number 480 रची बेटा. What is the purpose of retention enema? Option A रची to reduce bowel action, option B रची to empty the bowel, option C रची to relieve distension caused by flatus, option D रची to soften the hardened pieces and gently stimulate the peristalsis. So which option is the correct answer? So correct answer is option D, to soften the hardened pieces and gently stimulate the peristalsis. This is the purpose of retention enema, right? Option D is the correct answer. Next question, question number 489. What comes under category 1 of the biomedical waste segregation? What comes under category 1 of the biomedical waste management or biomedical waste segregation? Option A animal waste, option B microbiological and biotechnical waste, option C human anatomical waste, and option D discarded medicine. So which option is the correct answer beta? So फटाफट आंसर कर दियो. So correct answer is which option beta? Which option is the correct answer? So correct answer is option C. Option C is the correct answer. Human anatomical waste comes under category 1 of the biomedical waste segregations. Option C is the correct answer. Very good. Next question, question number 490. Which of the following vaccination is given through the intradermal route? Option A BCG, option B Japanese encephalitis, option C hepatitis B, option D measles. So which option is the correct answer? फटाफट आंसर कर दे बेटा. Which option is the correct answer? फटाफट आंसर करो. सो करेक्ट आंसर है समस्त को जाना BCG. वेरी गुड. सूर्य नारायण पति, ऑप्शन ए इज द करेक्ट. जाग्ञश्विनी तांडे, ऑप्शन ए. एम प्रधान, ऑप्शन ए. पद्मा नाइक ऑप्शन ए, तनुश्री पोहान ऑप्शन ए, प्रदीप्त गुड ऑप्शन ए, प्रियंका जेना ऑप्शन ए, वेरी गुड, स्वरज कुमार, गिरीश महापात्र ऑप्शन ए, वेरी गुड बेटा, बीसीजी हवा, बीसीजी वैक्सीन इज गिवन थ्रू द इंट्राडर्मल रूट, इंट्राडर्मल बीसीजी ही दिया हुआ है आईडी रूट, राइट। नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 491, 1 टीस्पून इज इक्वल टू हाउ मेनी ड्रॉप्स, फटाफट आंसर कर दो। 1 teaspoon is equal to how many drops? So correct answer कौन हो बेटा? 60 drops, 75 drops, 15 drops, 30 drops. So which option is the correct answer? फटाफट आंसर कर दो बेटा। नर्सिंग फाउंडेशन रे क्वेश्चंस बेटा, फंडामेंटल ऑफ नर्सिंग रे क्वेश्चंस, मोस्ट इंपोर्टेंट एमसीक्यू। So correct answer is 75 drops, right? 1 teaspoon is equal to 75 drops. Option B is the correct answer. Next question, question number 492. A nurse is caring for patient on diuretic therapy. The nurse would monitor the patient for which acid-base disorder? Most important MCQ बेटा, most important MCQ, 5-star वाला questions. A nurse is caring for a patient on diuretic therapy. The nurse would monitor the patient for which acid-base disorder? Option A respiratory alkalosis, option B metabolic acidosis, option C respiratory acidosis, option D metabolic alkalosis. So which option is the correct answer beta? So correct answer is metabolic alkalosis hoba beta, metabolic alkalosis hoba, right? Metabolic alkalosis hoba correct answer. So correct answer is option D, right? Option D is the correct answer. Next question, question number 493. What is the meaning of PRN in medication administration? Option A is immediately, option B is when required, option C is alternate day, option D is every morning. So which option is the correct answer? फटाफट आंसर करो। PRN in medication administration, यार माने कौन बेटा, फटाफट आंसर कर दे। PRN medications means प्रोरेमेटा, प्रोरेमेटा कहते हैं ना यार, फुल फॉर्म होची प्रोरेमेटा, प्रोरे सॉरी प्रोरे नाटा, मेटा कोची नाटा, प्रोरे नाटा, प्रोरे नाटा मीन्स कौन बेटा? PRN मीन्स ऑप्शन B is the correct answer. Very good. When required, PRN means when requires, है ना? It is as per the need when required हमें देउछे ना PRN रो माने। नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 494 है प्रोजेस्टेरोन एंटागोनिस्ट इच ऑप्शन है मिजोफ्लोस्ट्रल, ऑप्शन है मिफेप्रिस्टोन, ऑप्शन सी है रिजेस्टेरोन, ऑप्शन है प्रोस्टाग्लैंडिन. सो व्हिच ऑप्शन इज द करेक्ट आंसर बेटा? सो करेक्ट आंसर है मिफेप्रिस्टोन. प्रोजेस्टेरोन antagonist is mifepristone, right? Mifepristone is also known as anti-progestin RU486, right? अब कौन कहते बेटा मिफेप्रिस्टोन को? कौन कहती? एंटी राइट? एंटीप्रोजेस्टिन RU486 कहते. This is also known, mifepristone is also known as anti-progestin RU486, right? This is the pure progesterone antagonist beta. This is the pure progesterone antagonist, right? Next question, question number 495. A patient is posted for cataract surgery. Which type of eye drops are to be prescribed? A patient is posted for cataract surgery. Which type of eye drops are to be prescribed? Eye department जो मैंने काम करते हुए बेटा जानी थी वो. ऑप्शन नीचे माइड्राटिक्स, ऑप्शन बी प्रोस्टाग्लैंडिन्स, ऑप्शन सी कार्बोनिक एनहाइड्रेस इनहिबिटर्स, ऑप्शन डी रचे बी ब्लॉकर्स. So which option is the correct answer? Which option is the correct answer बेटा? Which option is the correct answer? तो करेक्ट आंसर अच्छी है मेडियाट्रिक्स हवा बेटा, मेडियाट्रिक्स. दिस इज कौन करे बेटा? पिपिलरी डायलेशन करे, पिपिल को डायलेशन करे, पिपिलरी डायलेशन है ना, पिपिलरी डायलेशन हुए से पे मेडियाट्रिक्स दिया हुए. Mediatrix drops are prescribed when patient is posted for a cataract surgery, right? So कौन Mediatrix drops बेटा जाने जा? साइक्लोपेंटोथॉल सुनी तो साइक्लोपेंटोथॉल सुनी ना ना आई वर्ड रे. ट्रोपिकामाइड, These all are the pediatrics eye drops, right? Next question, question number 496 is what is the side effect of drug ethambutol? Option is optic neuritis, option B is hepatotoxicity, option D is deafness, option D is hypersensitivity. So which option is the correct answer, beta? So correct answer is optic neuritis. Optic neuritis is the side effect of drug ethambutol. So one of the most side effect for drug ethambutol, that is the optic neuritis. Optic neuritis kaana beta? Optic neuritis, this is the inflammation of the nerve fibers at the back of the eye. This is the inflammation of nerve fibers at the back of the eye, right? So ethambutol कौन करोची vision problems करोची बेटा, right? Next question, question number 497. Rectal medications are typically supplied in the form of ठीक. Question number 497 है बेटा, rectal medications are typically supplied in the form of option is suppository, option is liquid, option C is crushed tablet, option D is open capsule. So which option is the correct answer? Rectal medications are typically supplied in the form of suppository form रे आउछि ना बेटा, suppository. Option A is the correct answer. Very good. Suppository form रे आउछि ना बेटा, rectal medications are typically supplied in the form of suppository. है ना? Option A is the correct answer बेटा. suppository आउछि ना, हमें rectal suppository दो छै ना बेटा, stool को soften करबा ପାଇଁ, constipation हेतिले दो छै ना, constipation patient मानन को rectal suppository दो छै ना, जो थरे glycerin थाए बेटा. vaginal suppository आउछि, है ना नहीं, rectal suppository आउछि बेटा, है ना नहीं. So option A is the correct answer बेटा. Next question, question number 498. अच्छा, nasally administered medications are typically option is in liquid form, option which is drops, option C is cross tablet, option D is open capsule. So which option is the correct answer? So correct answer is बेटा option B, drops form आउछि, है ना नहीं. Option B is the correct answer. Next question, question number 499. Subcutaneous or SC administration distributes medication into the option is epidermis, option is muscles, option is fatty layers, option is venous. So which option is the correct answer? बेटा फटाफट आंसर कर दो. Subcutaneous administration distributes medication into the epidermis, muscles, fatty layers, and option D is venous. So which option is the correct answer बेटा? So correct answer कौन हबो? फटाफट आंसर करो. फटाफट. Subcutaneous administration distributes medication into the so correct answer beta fatty layer होगा. Option C is the correct answer. Option C is the correct answer. So today last question for this session beta. Last question is an endogenous pain control neurotransmitter. Option A is acetylcholine, option B is substance, option C is endorphin, option D is adrenaline. So which option is the correct answer? So correct answer is beta endorphin. Endorphin, this is endogenous pain controlling neurotransmitters, right? Endorphin hormones release when the body feels pain or stress. When the body feels pain or stress. So option C is the correct answer beta, right? Option C is the correct answer beta. So thank you so much beta. आज का लाइव क्लास रे जॉइन होइतिबारो तम मान को बहुत बहुत धन्यवाद. एमती पाठ पढु था निहाती भाव तम मान सिलेक्शन हेजबो. This is my blessing to one and all. Very good friend, relief hormone beta, right? Endorphin. So thank you so much to one and all beta. जो मैंने पर्यंत वीडियो लाइक करना प्लीज, जदि हेल्पफुल होइदियो निहाती भाव में लाइक कर दियो वीडियो को एवं शेयर कर दियो एवं जदि चैनल को जो मैंने फर्स्ट टाइम देखुछ निहाती भाव में चैनल को सब्सक्राइब कर दियो कहीं ना आमर महामाराथन क्लासेस चली ना सो बेटा नेक्स्ट क्लास रे देखा हबो आसंता काली राइट से पर्यंत स्टे मोटिवेटेड एंड बेटा पाठ पढ़ु था राइट थैंक यू सो मच सूर्य नारायण पति थैंक यू ऑल एमती आम डिस्कसन करथवा जे पर्यंत एग्जामिनेशन है नहीं बेटा हमर कंटिन्यूअसली क्लास चलतिबा रैंडमली पूरा राइट जे पर्यंत एग्जाम आसीने है से पर्यंत हमर रैंडमली क्लास कंटिन्यूअसली चलियो बेटा कंस्टेंटली राइट सो रहली बेटा थैंक यू सो मच वन एंड ऑल जो मैंने चैनल को सब्सक्राइब करना प्लीज सब्सक्राइब द चैनल सब्सक्राइब कर दियो एवं लाइक कर दियो ता द्वारा मो मोटिवेटेड है कि तम मानक निहाती भाव डेडिकेटेडली क्लास करी राइट थैंक यू सो मच बेटा बाय बाय टाटा